Hello, welcome to Bipolarcast. This is a podcast where we talk to people with bipolar disorder who are using ketogenic diets or metabolic therapies. Today we have Dr. Bret Scher on the podcast, who is our first famous guest. So we've changed our backdrops, put on shirts, and we're cleaned the place up a bit. You know, I've got a famous person on today. Bret is a board certified cardiologist and lipidologist practicing in San Diego and licensed to practice in 7 states. He's the medical director of dietdoctor.com and hosts the Diet Doctor podcast. Dr. Scher's main focus is on preventing and reversing heart disease naturally rather than putting patients on medication and performing surgery. When he started his own preventative wellness center, he was introduced to the whole low carb world. Being a bit skeptical at first, he was soon convinced by the benefits of a low-carb diet. In Dr. Scher's many patients suffering from heart disease, he found that there was a big overlap with cardiovascular disease, diabetes, metabolic syndrome, and insulin resistance. When he started treating his patients who suffered from heart disease with a low-carb diet, he could quickly see signs of improvement or even full reversal in all of these diseases. Dr. Scher also has obtained specialized certifications in functional medicine, nutrition, personal training, and behavior modification. He's the author of the book, Your Best Health Ever, and he has a blog and website at low-carb-cardiologist.com. He also started running triathlons at 14, I believe. Is that correct?
Yeah, that's right.
Wow.
That's right.
What inspired you to do that?
Well, you do good homework, good research for that intro. Yeah, the triathlon thing was almost just by accident. I'd always kind of been a swimmer, and I was always biking just for transportation. And I was kind of a little kid. And so I went to this gym where my dad went to try and get bigger and get buff and work out. And there were these pro triathletes there. This was in the 80s, and triathlon wasn't as big and popular as now, but there were these pro triathletes there, and they kind of thought it was cute that here's this little 14-year-old working out in the gym. So they just said, hey, why don't you try this triathlon coming up? And they helped sort of train me to get me ready for the triathlon. And said, sure, I could do that. A little bit of overconfident 14-year-old, but I got bit by the bug as soon as I did my first one. I almost died crossing the finish line, but I crossed, and I was just bit by the bug and just kind of took off from there. Yeah.
That's incredible. How many triathlons did you do when you were a teenager?
Oh boy. I mean, I did them. I competed for over 10 years, so I don't know how many I did, but I sort of worked my way up from the sprint distance to what was called the Olympic distance, to the half Ironman, to the Ironman, and then kind of said, all right, that's enough. That's good.
Amazing.
How was the Ironman? That's crazy distance.
Yeah, the Ironman was awesome. So 2.4 mile swim, 112 mile bike, and a full marathon, 26-mile run. So the one I did was up in Santa Rosa. It's called the Vineman. It's beautiful. I mean, just so beautiful. You swim in the Russian River, and then you bike by the wineries and run in just some beautiful sort of rolling hills. And it was a 2-lap race. So the swim, I was always a good swimmer, so the swim was great. The first lap of the bike is like, oh, this is great, I love it. The second lap of the bike was starting to be a bit of a bear and starting to wear down. And then the run is just brutal. I mean, once you've been out there for hours and hours, it's hot out. And but gosh, it was just so, I mean, again, crossing that finish line is just one of the greatest feelings. And just, you put so much work into it. And anytime you put so much work into something and see the rewards, and where it's not clear that you're going to see those rewards, it's pretty questionable, but it's just such a wonderful feeling. I loved it. I wish my body would let me do it again, but right now I think I'm past those days.
Have you got into these triathlons, Matt? I've never done one.
No, I've done short ones, but I've never done anything like an Ironman or anything significant. I mean, maybe now that I'm on a low carb diet, I could have the energy to do something crazy. I don't know.
It's funny because when the kind of early Ketones just came out, I think the only people buying them were like myself and a bunch of low carb enthusiasts and Tour de France, cyclists. It was all kind of like triathlon people, and that was the kind of scene for it back then. But we were super excited to be on your podcast, and thank you for having us, because I think it was especially meaningful because you're such a respected and person in this kind of scene, and you have so much integrity about what you report, and you're very willing to change your opinions and to when the data shifts or you see something new, you're one of the few podcasters that's not just like on one narrative. You're actually like going with what the evidence is, and that's really what made it all the more. It was all the more great to speak on your show because of that, knowing that you have that approach. What you've been talking for quite a long time about the benefits of ketosis and low carb for brain health with podcasts like with Dom D'Agostino and other people that you've had on your show, even psychiatrists in the past. And when did you first become aware of the kind of benefits of keto for brain health?
Yeah, it's a great question, because when I got started with keto and low carb diets, it was all about weight loss and metabolic health. And that was my focus. I didn't even really think about brain health at all. And, part of that is just the way sort of we're trained in medicine, right? We're not really trained about the body brain connection, even though some people talk about it. You really think in your buckets. This is for metabolic health, this is for cardiovascular health, and that over there is for mental health, and don't always see the connection. But what I started seeing in patients was just people feeling better mentally and physically. So right away it was like, okay, there's something going on in the brain when people are on low carb and keto diets. Is it just being healthier in general? Is it, they're losing weight, they're feeling more energetic, they're exercising more, getting outside more, right? There's like a combination of things that wasn't clear. But then I started to see some of the reports from people like Dom D'Agostino, like you mentioned, about how ketones sort of work better, sort of air quotes, in the brain, that they are this different fuel that the brain can use. And then started learning about insulin resistance in the brain and the connection to Alzheimer's. It was actually also one of sort of the big ins for me in terms of connecting the ketogenic diet and mental health and brain function. And then it just opened all these windows, and I started to learn more and more about personal experience. So people like Amber O'Hearn talking about it, and then of course both of you, Matt and Ian, talking about it, and started to learn more about the research and the connection between, the overlap with seizure medications and bipolar and psychosis and depression medications, and the common chemistry. It all just sort of to come together. So I can't say there was like one moment where it sort of like clicked, but it was like this general progression to say like, wow, I mean, my focus has been on metabolic health, but it's really clear that there is a strong connection with mental health. And, like a lot of things, I mention a lot how our medical approach to metabolic health is backwards and really doesn't achieve the goals we need to achieve, and doesn't work with the patients well enough to help the patients and see things from the right perspective. I think you can, copy and paste the same thing for mental health. And so focusing on nutrition and lifestyle really should be job number one. And with all this emerging evidence for a ketogenic diet, it certainly should be an option. And, I say the same thing for metabolic health, right? It's not that it's right for everybody. It's not that it's the treatment for everybody. But for it to not even be an option that people are talking about widely is sort of a crime. So that's why, your podcast and you both telling your story and doing the research and furthering this movement, I just think is so important.
Thank you.
Is it challenging being an advocate of these types of therapies when it's like still in its infancy and not a lot of medical professionals know about this and that type of thing?
Yeah, it is a challenge, because a common response is, well, where's the studies? Where are the studies to show that this works and is better than X, right? Is better than whole food plant-based, or better than some other diet. And, we've got to be honest, we have to be clear the state of the evidence. And like you said, it's in its infancy, right? So I can't point to those studies and say, here it is, but I can point to a number of published case reports. I can point to tons of anecdotal evidence and personal stories. I can point to mechanistic papers that have been written, right? So there's this growing base of the evidence. But then the question is, well, what are the other options, and what's the downside of trying it, right? So it's one thing if there were just hundreds of other wonderful options that work great and have no side effects and people love, right? But that's not really the case. So then it's trying to convince people, look, I can't say this is guideline-based therapy. I can't say that this is proven, air quotes, with randomized controlled trials. But when you think about it practically, and when you see the evidence that is there, why not try it? I think is the better question, rather than, show me the evidence why I should try it. So it's approaching it from a different perspective that not all people get at first, right? People just want to follow the guidelines, and, for good reason. There's a reason for guidelines in the general population and in practices that are super busy, that you don't have time to kind of work with your patients to get them safely on a keto diet to either, treat whatever condition it may be, especially a mental health condition where if things go wrong, they can go bad kind of quickly. So, I mean, I get the hesitancy. So yeah, I guess going back to your question, is it a challenge? Yes, those are the challenges. Anytime you're sort of promoting a relatively what seemingly new therapy for a condition that people have been trained how to treat a certain way for so long, yeah, there are definite challenges. But, again, getting the word out is the way to go, so more and more people start to hear about it.
I think one thing that'd be great to hear is because there's a lot of psychiatrists that watch this show, and you were really early on when you were talking about the benefits of ketosis and low carb for heart health. And in some ways, we're in this situation in psychiatry where we're kind of in this early stages where people are treating patients. There was the recent paper from Georgia Eade showing these 31 patients having that you were posting about, and they're having this really significant shift. You never see mood improvements of that degree from, you know, like very, very severely depressed to almost in remission within a few days on a ketogenic diet. And so we're in that early stage where people are seeing this with their patients, but we're still waiting on the clinical trials. And this is obviously the next stage that we're working on. What advice would you give to psychiatrists from your experience being someone that talked about this early on and being a forerunner in this heart health side of ketosis?
Yeah, it's a great question. And I think the advice I would give is you have to be open to it and you have to get support. Because, you know, when I was starting people on a keto diet, I couldn't have done it on my own. I was lucky enough to be working with a health coach who was extremely knowledgeable on ketogenic diet. So I needed his support so that I could help start my patients on it and start them safely and start them, you know, effectively. And so they're not going to give up because they have some side effects in the beginning or whatever. So I think the number one thing is get help if you're unfamiliar with ketogenic diets. But also, you know, follow people like both of you and Dr. Chris Palmer and Dr. Georgia Eade and Dr. Shivani Seth, you know, follow them to learn about how they're using ketogenic diets in their patients. You can learn from the people who are experts and have been there before. Use resources like Diet Doctor, you know, to plug Diet Doctor. I mean, that's sort of why we have created all these resources and part of my job since I've been there is to help tailor some of the resources to clinicians as well. So that psychiatrists can learn from a clinician focused document about how to start someone on a keto diet, what to look for, you know, what are some of the challenges, what are some of the ways to troubleshoot it with your patients and adjusting medications. So don't try and do it alone, but to get some help, get some assistance so that you can help your patients succeed, right? Because we don't expect a psychiatrist to be a nutritionist and to come up with the meal plans and the recipes and, you know, to be able to give the day-to-day support on lifestyle changes if they're not that familiar with it. So lean on resources to help you with that part so you can focus on the mental health of your patient.
You know, it was challenging for me when I started this diet because I have roommates who love carbs. They love ice cream. They love pizza. They love burgers with buns, all of this stuff. So is there any advice you have to people who are just starting the diet on how they can maintain adherence or how physicians can help them or dietitians or anything like that?
Yeah, that's a great question. I remember when you were on my podcast and you mentioned that your roommates are surrounding you with high carb foods, which really increases the temptation and increases the difficulty. And a lot of times, you know, it's like an alcoholic shouldn't walk into a bar, right? So it's a lot of times that would be the advice to give is sort of try and separate yourself from anybody who is putting you in that type of situation. But you can't always do that, especially if you have kids eating mac and cheese, or if you're, you know, your spouse or your friends or whatever. You're not going to cut off your friends and change your entire life just because they're eating pizza. So that's one thing that I really liked about a ketogenic diet is the rules are simple. It's fairly black and white in terms of the rules. Whereas if you're getting started and you're just trying to eat a little healthier and make the little changes here and there, a lot of people can succeed that way. But when there are a lot of temptations around, that could be a little bit more challenging. So when you are surrounded by temptations and having trouble with it, that's where here are the rules, you know, you identify as, I am now someone who eats a ketogenic diet. That's who I am. So now it's like, okay, I'll try a little of this, try a little of that, because no, that's not who you are. And it's perfectly fine to do that. And as long as you communicate it well with your friends and family and loved ones, so they understand, you know, you don't want to be the weirdo who's not eating ice cream or pizza, but you say, oh yeah, you know, he's really focused on improving his mental health, his metabolic health, his heart health, whatever you want, whatever it is. Oh yeah, he's really focused on improving that. That's why he's not doing that. So people understand. So you're not thought of as like the strange person who eats weird, but it's for a purpose. It's just like, no one's going to say, oh, he's that weirdo who takes medications for his cholesterol or for his blood pressure, right? It's a therapeutic intervention. So it needs to be thought of the same way. So trying to, you know, phrase it that way with the people you're around, I think that's some of the best advice people can take home.
The struggle for me was always being around my PhD supervisor. I mean, he would always want to meet at a Chinese restaurant. So I was like, oh man. And he would talk to me about his insulin robust. I was talking about insulin resistance. He'd be like, no, Ian, it's about insulin robustness. You need to build up the robustness, eat lots of rice. I was like, I don't think this is scientific. It was a real challenge. I think,
Yeah.
it's so difficult when you're taking this different path with it. And especially when you're doing it with a mental health condition, because at least there's very clear evidence for in terms of the weight loss for diabetes and the metabolic health effects it has, but mental illness is already very badly understood, and the stigma around it. And so to have the stigma around mental illness plus saying that you're using a dietary intervention is like, it can be very difficult for people to address or talk about. But you're saying as well that when you look at the science, there are precedents in the literature for these effects on the brain, the huge literature on epilepsy, over 100 years of use in epilepsy showing this stabilization of seizures. Why do you think this dichotomy came up between the body and the brain, where there's this metabolic health crisis with the body, but this is not affecting the brain? And do you think that's legitimate?
Yeah, I mean, I think because it's easier. I mean, it's really easy to compartmentalize, and not think about too many systems at once. That would be my guess as to why it sort of started. And when you look at a drug-based approach to something, you want one problem, one target, one drug, clean, because otherwise you're going to get side effects if it's too broad-reaching or whatever. So if you're treating a metabolic health condition, you don't want anything that's going to have any brain effects or psychological effects, because usually those are going to be side effects if you're talking to drug therapy. But when you talk about lifestyle therapy, now it's something completely different. But look, we've got to be honest, like, our medical society is not well geared to lifestyle therapy. I think that is changing and improving, but really has been a drug focused medical society for far too long. And that when you're drug focused, it's much easier to compartmentalize rather than say, look, there's a potential underlying mechanism for all of this, right? Insulin resistance, metabolic dysfunction. It may not be the one explanation for everything, but it likely has a contributing effect on just about everything, whether it's mental health, whether it's cardiovascular disease, diabetes, so many different conditions, inflammatory conditions, autoimmune conditions. There's likely a connection there. And so bringing that picture in the lifestyle therapy approach makes sense, but it doesn't make sense from a drug approach. So I think that's part of the problem.
Are there any other lifestyle interventions that work well in tandem with keto to help with some of these metabolic issues or metabolically spurred issues?
Yeah, great question. And the answer is a resounding yes. We focus so much on nutrition because that's the one thing we all have to eat. We all have to make decisions multiple times a day about what we're eating. So nutrition tends to be the biggest focus. But, exercise is, I think, so vitally important, which really has, you could say, gotten a bad rap because, you can't outrun a bad diet. What you do in the kitchen is more important than what you do in the gym. You hear all these things. In general, it's true. If you want the one intervention with the sort of the biggest impact, it's likely going to be nutrition, but that doesn't mean exercise is not important. I mean, exercise, I think, is vital for, if you're losing weight, making sure it's healthy weight loss, because you want to maintain lean mass while you're losing fat mass. You don't just want to lose weight, period. And when it comes to mental health, we know that exercise, there's runner's high, and there's, it's not just for runners. It's really any type of exercise high. We know exercise is connected to brain endorphins, and we know it's connected to brain chemistry. So it makes complete sense that exercise would be beneficial for mental health as well. And there are studies for moderate depression looking at nutrition and exercise versus medications, and nutrition and exercise tends to work just as well for mild to moderate depression. So, I mean, there's definitely a connection there. And of course, sleep. I mean, sleep is one of the biggest ones. And you've been very vocal, Matt, about sleep and the role it's had for you. And I think that's so true because, it's in two ways. One, it's going to affect the decisions you make during the day. If you're chronically underslept, you're not going to make as good decisions. You don't have sort of as good of an executive function. But two, it clearly affects the brain chemistry as it affects metabolic chemistry, insulin resistance. Poor sleep can affect both of those. So definitely the connection there. So if you're talking the top three, it is nutrition, exercise, and sleep, all very close together in terms of their importance. Yeah.
It really struck me. I was at that Keto Live conference in the summer, and there was presentations on circadian rhythm, and it was just like watching presentations on bipolar disorder and circadian rhythm. All the insulin release and metabolism features of circadian rhythm are, it was almost like being at a bipolar conference in some ways. It really struck me how similar the topics were. How do you see the integration of these? I should mention that when the diet doctor research are excellent. We've been putting them in the show notes since we started, so thank you for bringing them up. I think even before we said spoken to you, we had them in the notes because they're just the best places we find for this stuff. And how do you recommend integrating some of these other metabolic factors with diet? So sleep, exercise. Can you recommend some places to look for how to kind of bring these together into a kind of lifestyle for people that are dealing with these conditions?
Yeah, good question. What we do, so at Diet Doctor, we have sort of this exercise course for beginners, and because I think that's one of the hardest things. If you're someone who's exercised your whole life and you were an athlete and you're comfortable in the gym and you're comfortable, doing interval training, and you just sort of slipped up a little bit, that person's going to get it back. That person's going to get it back and do well with it when they're ready to commit to it. It's the person who kind of never really exercised, didn't love it, hasn't been very active most of their life. That person is the one who tends to struggle the most if someone says, "Oh, start exercising more," because then you're like, what does that mean? What do I do? Where do I start? Maybe you try something and you get hurt because you tried too much, or you do something you don't enjoy because you think you're supposed to do it. Like you're sitting there staring at a wall for 30 minutes on a treadmill or whatever. So we have this exercise course for beginners. And it's called our Let's Get Moving course at Diet Doctor. And the idea is to get people doing exercise they can comfortably and safely do. That's basically teaching them the basics of exercise and then progress them as they get better. So I think starting with something like that is important. If you can afford a personal trainer, that's great, because then you have one-on-one or even like a group class, but it's got to be people who are similar to you in terms of your ability, your knowledge, your fitness, because it's starting in the right area for you. So, how to get started. There's so many different online options, I'm sure, but I'm not familiar with all of them, except I am familiar with the one we have at Diet Doctor. So gearing towards those beginners to progress. So, soon you wouldn't be a beginner and you'll have more knowledge about safety and efficacy for exercise.
That makes sense, that starting with something doable that people can do and not making it overwhelming. I mean, I know I've run into that challenge myself about just making it something I can adhere to and stick to. Here's another question that I'm curious about, which is, how much do we understand about the actual biology of the cells and the mitochondria and how things change and how the metabolism changes when people go on keto and how it affects the brain at that level?
Yeah, that's a super interesting question. Dr. Chris Palmer is coming out with a book that talks all about this. So I think it's going to be really interesting to see what he's put together in terms of all the research that's out there and the knowledge that's out there. I think it's clear we can't say for certain like what happens and exactly what the changes are, but I don't know. I think I'm as curious as you are in terms of what the studies are going to say about the cellular level, the mitochondrial level. But we know when you're switching fuel sources and you're not relying on glucose and you're not having high insulin levels, that combination has a lot of cellular effects for sure. And I think that's a lot of the reason why keto diets work for seizures, what the effect they have on the cellular level, on the energy metabolism level, on the cellular level. Like that's got to have something to do with why they work for seizures. So it makes sense the same for mental health. So I can't say that's my area of expertise, but I'm really curious. I'm going to be front and center to buy Chris's book when it comes out to learn more about this.
I'm super excited for that. It's going to be great. It's like you say with the connection to epilepsy, it's so striking that a lot of the anticonvulsants that are used in epilepsy are also used to treat bipolar and schizophrenia. And
right.
And then the ketogenic diet has not been kind of considered or studied, but there's still the same mitochondrial effects, the alternate fuel source to glucose, the reductions of inflammation, the GABA effects. They all apply to, there's many features of bipolar that are similar to epilepsy in that way. So it's funny how strong that connection is but it's never been studied or considered. And then gradually the case studies just started coming out, people telling their story. And I guess one of the things that was really cool about you having us on Diet Doctor as well is it's not easy talking about bipolar publicly. It really can have consequences and stigma for your life, especially being at university, and it certainly limits things that I can do in the future. But the reason me and Matt talk about this is not it's really because it's become so desperate in mental health, the situation that the suicide rate for bipolar at the moment is 30 to 50%. And we know a lot of people who have these conditions, and we go to these kind of support groups and meet up things, and you see what happens to people. And this is tragic. It really is a real kind of quiet tragedy that happens with people with these conditions. And it's not being talked about or addressed, and it's very much been swept under the rug. Not intentionally, but it's just not recognized because these people live very quiet lives of taking medications, having very few friends or people they're in contact with. And it really is sad for their families seeing them deteriorate under the current kind of paradigms of dealing with this. And so the reason we're having this podcast is not because it's fun to speak about having a psychiatric condition. It really does can carry stigma and consequences for life that I've experienced, but at the same time, I feel like we do need to talk about it. And so we really appreciate you lending your voice to this as someone who's a leader in this field, because at the moment it's very much a grassroots kind of people with this condition just saying, hey, this is really helping us, and nothing else is helping us in this kind of a way. So we hope to keep spreading word about it through this. How did you see it evolve with heart health? And this is now much more recognized that this is so beneficial with ketosis. Were there any like key points you could identify where things shifted? Was it randomized controlled trials? Was it case series, or was it a patient movement? What was the thing that really helped it to become a way of approaching this that people recognized?
Yeah, I'll get to that question, but I want to comment real quick about the stigma part. And that's something that I think is pervasive in not just in sort of general society, but also within medicine as well to a degree. Because if you're not somebody who works in mental health, you sort of kind of don't want to deal with it. You think of it as something separate. Like there is a clear line, even among usually specialized clinicians, that they don't want to sort of cross that line. But I think we do have to think about it as one thing and get rid of the stigma, because we don't have a stigma for someone with high blood pressure. We certainly don't have a stigma for if someone gets cancer or whatnot. So, why would we have that stigma with mental health? And I think it's just because you see it, you can see it more, whereas you can't see the high blood pressure. And I think that's unfortunate. So I really appreciate what both of you are doing to sort of knock down that stigma and talk about it openly and say, look, it's, people have it. We're just like everybody else. And I think that's so important. So thank you for doing that. And I hope that at Diet Doctor, we can play a role in helping do that as well.
Thank you.
All right, so now it gets to your question. What was it that sort of helped me become, I guess, more comfortable with low carb and ketogenic diet for heart health? And I can't say it was really one thing, but it was more of a progression, because first it was about weight loss and blood sugar control in my patients. And once I saw those benefits by one, personal experience, clinical experience with them, and two, seeing the evidence that existed, but then making the realization that shouldn't be that big of a realization that, visceral fat, chronic inflammation, metabolic health, blood sugar, that's all cardiovascular health. Unfortunately, we focus too much on what are your lipids, and blood pressure and smoking and other things are important too. But this other bigger world of metabolic health is cardiovascular health. And there was this study published maybe like 2 or 3 years ago now that was a look at the Women's Health Initiative trial 20 something years later for these women who were enrolled, and 20 years later who got heart disease, who didn't, looking at the biggest risk factors. And LDL and ApoB were on there. They had a hazard ratio of LDL was like 1.3, ApoB was like 1.8. But then when you look at the insulin resistance factors, it was 6. And if you looked at type 2 diabetes and metabolic syndrome, it was like 10 and 8. So they were magnitudes higher association with cardiovascular disease than LDL and ApoB. And that's sort of this realization that sort of took a little bit of time, I'm embarrassed to say, but eventually got there to say metabolic health, not only is it cardiovascular health, but it's probably the most important part of cardiovascular health. So that's where this connection of a keto diet for me, for cardiovascular health, really started to grow. And then, of course, there's always that concern. Well, what about LDL? What about if LDL goes up? And there's so many doctors are worried about that. And so many doctors will say, don't try a keto diet because it might raise your LDL. Well, I think that's a ridiculous approach, because first of all, the studies show if you're starting a keto diet for losing weight or for type 2 diabetes, LDL on average does not go up. And even if it does, it goes up a little bit. And ApoB, which is the better marker, doesn't change. And Verta Health has shown this very well in their studies. So I think that's a falsehood right away. Now, what's interesting for this audience, though, is usually the people who do see an LDL rise are the people who are trying keto diets for some other reason, right? They're already relatively thin, relatively, healthy, maybe from a metabolic standpoint, but trying it for something else, whether it's mental health or an autoimmune condition or whatever the case may be. It's those sort of thinner, healthier people that do tend to see the LDL rise. Then the question is, what do you do about it? And that's probably the biggest area of pushback right now within the medical community for low carb. And it's always balancing the benefits and risks. But if you're improving mental health, or if you're improving metabolic health, you're drastically improving the quality of your life, that has to be factored in when you're assessing, benefits and risks of one marker changing.
And your work on being on the forefront of this lean mass hyper responders with Dave Feldman and Nick Norwitz has really helped people in understanding more about this. Could you say a little bit about that, your understanding of LDL? And
Yeah. So I think it's clear there are different versions of LDL elevations on a low carb diet. And the first one is either no rise or a small rise with no change in ApoB. And those I think you can basically ignore, because usually the cardiovascular risk goes down. Then there are those who have a more significant rise, and they're called the hyper responders. And then there are those who have a very significant rise, who are basically called the lean mass hyper responders. So like you mentioned, Dave Feldman, an engineer, but a citizen scientist, has really called attention to this. And together with Nick Norwitz and others, they've published a couple of papers sort of defining what this lean mass hyperresponder paradigm is, or what the phenotype is, and are also conducting studies to look at CT angiograms, to actually look at the vessels themselves to see if there's any changes there. So I love that they're not just spouting off on the internet and giving ideas. They're like controlling the science. They're furthering the science, which I think is phenomenal. But the basic concept is, what they found is those people had lower body mass index and better triglyceride to HDL ratios were more likely to get this dramatic response, whether it's a doubling of your LDL or a rise to 300-400, numbers that make doctors very uncomfortable, because the only other place we see those numbers are with a condition called familial hypercholesterolemia, which is a genetic condition you're born with, where your LDL is that elevated for your entire life. And again, there are two versions of FH. So not to get too technical, but I think this is important. There are two versions of FH. One is called homozygous. So we all have basically two alleles that code for this. So if they're both affected, then you essentially have no LDL receptor function, is a way to think about it. So the LDLs are 600, 700 for their whole life, and uniformly those patients are going to get heart disease in like their 20s or younger, and it's pretty devastating. But then there's a heterozygous FH. So one allele is normal, one allele has the mutation, and they tend to have rises in about the 200, 250 level. Why is that important? Well, because they don't uniformly get heart disease. Now, there is a subset of them who definitely is at a higher risk, but there's some heterogeneity there. So that's how I personally see this rise in LDL. If your LDL rises to the 400 or 500 range, I see that as very different than as the 200 range, because of that paradigm, that analogy of FH. Now, do I have evidence to support that? No, but when we're working in an area without much evidence, we sort of have to do our best. And so that's sort of how I kind of look at it. But the biggest picture is the biggest point is putting it in the broader picture, and not just focusing on LDL, but saying, what has this lifestyle done for your quality of life, for your mental health, for your metabolic health, for your blood sugar, for your blood pressure, to the context of those improvements, and not look at it, by itself.
Where did this idea come from that LDL is such a pernicious marker?
Well, it starts from, way back in the, I guess you'd probably say the 80s. The 70s, it was more like total cholesterol. 60s and 70s was total cholesterol. and then merged to LDL. And it was these association studies, those who are more likely to, it sort of started with the fat movement, the eating saturated fat movement, higher LDL, and having heart disease, that there was an association. The higher the LDL, the higher the risk of heart disease. Although when you say that, it sounds like it's, every elevation is 100% guaranteed to give you heart disease. No, it's a smaller association, but there is association. You look at the curves, and the higher the LDL, the higher the risk of heart disease. The curve goes up. I mean, not straight up, but it goes up. And then, of course, medications came, the lower LDL, and then you can make a small improvements. But again, I think it's so important to say perspective, right? Because when you're looking for a villain, or when you have a hammer, everything looks like a nail. You can make those analogies. And I think LDL kind of falls into that. But it's not that we can dismiss it and say, oh, they were totally wrong. LDL has no association to heart disease. There is an association. But the majority of the evidence is in the general population with metabolic dysfunction, eating sort of a high fat, high carb, high calorie kind of diet. That's the general population who's studied in where most of the evidence comes from. So we can say in that population, LDL has an association, lowering LDL has a benefit. But what about other populations? Well, there's a lot less evidence on those other populations, which is where a lot of the confusion comes from. Some people will say, well, we don't have evidence for those people who are metabolically healthy on a low carb diet that LDL is important at all, so we should just ignore it. And other people would say, well, it's true, we don't have evidence, but until we have evidence that it's safe, we should treat it the same as we do in everybody else. So who's right? Well, we don't know, right? We don't know who's right. Those are the two sort of approaches that you can take clinically.
And the other question I had, so we're talking about low carb here. Do you see similar benefits when people go, for example, on a low carb diet, but not in full ketosis, versus actually trying to get the carbs under, say, 30, 40 grams, trying to get millimoles per liter above 1.5, like I did when I originally went on this? And if so, is there a difference in the kind of symptom relief in these diseases?
Yeah, great question. And here I think is where it is useful to really differentiate metabolic health from mental health or from any neurologic conditions, because I believe, and I think the evidence shows, that if you are trying to focus on healthy weight loss and improving your metabolic health, that ketosis is not necessary. So you can follow a 50-gram carbohydrate diet if the majority of those carbs are coming from above ground vegetables and a few nuts and a few berries, and you're not in ketosis, your ketone levels are 0.2 or whatever, you can absolutely achieve improved metabolic health and healthy weight loss. You can also do it with a ketogenic diet with high ketone levels, but I'm not sure that there's a necessary connection there. But when it comes to neurologic conditions, that's where I think the evidence is starting to show that the ketone levels matter, and that higher ketone levels could be better. Now, again, I can't point to a handful of studies proving this beyond doubt, but it certainly seems that makes more sense. And if you're trying to change the fuel in your brain's going to always need some amount of glucose. It's not going to run 100% on ketones. But if you're trying to, feed it a better fuel, and that makes sense that you want that higher level of ketones. Whereas for metabolic health, what you really need to do is just lower the blood sugar, lower the insulin. And you can do that without being in ketosis, although being in ketosis certainly can help maybe do it a little faster, a little more aggressively, or whatever the case may be. But yeah, for mental health, I do think it makes a difference. So, chasing ketones, I'll frequently say you don't need to chase ketones, don't worry about it. But I will say for mental health, I think it does make a difference. And maybe that's when you want a little higher fat, maybe 20% protein and higher fat diet. Whereas for metabolic health, maybe you go 30% protein and a little bit lower fat, making small changes, which can affect the ketone levels. And the other thing is like exogenous ketones. Again, for metabolic health and just healthy weight loss, I'm not sure exogenous ketones have a role. But if you're treating a specific condition where ketone levels matter, maybe they do. And I think that's going to be another interesting field. There's studies already on Alzheimer's or Parkinson's about using exogenous ketones. That seems fairly encouraging. So would that then translate to all other neurologic and mental health conditions? Maybe. I think that's going to be really interesting.
I think that's such an important point, because this blood-brain barrier transport of ketones, and it upregulates at higher ketone levels, and you can see why, because the brain doesn't just want to shift its whole fuel source unless it's really sensing this is necessary. So it's kind of like, we're just going to see what happens with this ketone thing, you know, what levels we get to, and then we'll start to upregulate the transport into the brain. And then when that happens, that appears to be when the seizure reduction effects occur. Like you're saying, you know, at these higher levels of ketones, there's not a huge amount of data from the epilepsy studies, but the studies that have looked into it have said, you know, above 2, and also keeping your glucose low is important, because the glucose blocks the uptake of the ketones into the brain. So I think there's going to be so many fascinating things to discover about this. I can just report from my own experience. I did a year of measuring ketone and glucose, and it was the GKI index, the lowering of the glucose and the heightening of the ketones, and keeping them above 2 was really significant. I found that if I keep them above 2 or 3, I'm basically in clinical remission and nothing can happen to me. And then as you go into lower levels, there's the possibility of depression again. So it was really interesting to see that. I need to actually put a blog about that at some point, but I totally agree.
Well, that's interesting, because if you're talking about exogenous ketones, if you're eating, you know, high carbs still, but taking the exogenous ketones, thinking that's going to make the difference, it might not, because your glucose ketone index isn't going to be much better. But if you're just using them to supplement for a low carb diet where you are keeping those ketones, or sorry, the glucose low, then that would be a very different scenario. Yeah, so I think that's really interesting.
Definitely.
And also, when it comes to the go ahead.
I was just going to say that I have transitioned to not tracking my ketones, eating high fat, eating protein, not eating any bulk carbs. So no lemonade, no potatoes, nothing like that. And then taking Keto Start twice a day. And I've seen no hypomania, no signs of mood instability, nothing like that. Even though my ketones are probably in the 0.3 to 0.8 range right now.
It's just crazy that this is possible, because you never get results like this on any of, I've tried all the, as you have, all the traditional medications for this, and I'm not against medication. It can really help people when they're in these acute states and they really need help in hospital. But I've taken lamotrigine and things like this, and keto is it's like a fundamentally different shift in the brain. It's like going from being well to being completely unwell. It's not like you're just suppressing the mania or putting the dampeners down on the brain. It's really like the brain is having energy to work properly in the normal way. So and with the Keto Start, is that like a ketone salt, isn't it? Or
exogenous ketone powder I take twice a day. It's very good. I like it a lot.
I need to try that. I've been using this ketone ester, but I'm still not sure. I think the ketone salts are probably healthier, like long term, although they're still waiting on the data for this. Did you have any insights on that, Bret, with the ketone esters versus the ketone salts? Have you seen for heart health if one is preferable or safer in the long term? Or
no, I don't think we have enough evidence to say one is better than the other. You know, I think for, you know, esters I think the evidence shows that they can bump your ketones higher faster and with a smaller volume of drink that you have to take. But that's really the only evidence I'm aware of comparing the two. I don't know any evidence suggesting that one has different effects on health than the others. Although the ketone salts, if you are salt sensitive, it could be a lot of salt that you're taking in. But, you know, we really overplay the importance of a low salt diet too. That's a whole nother topic. But there is that small subset of the population that is salt sensitive that would have to be aware of that.
I mean, to give you an idea how emerging this field is, when about 4 years ago, or when I was starting to look into esters, I was maybe 5 years ago, it's when Dr. Veach had released, or this ketone ester based on Dr. Veach's formula, and you could buy it online, and there was all these Tour de France cyclists buying it up, and I couldn't get a bottle of it because there was all these cyclists buying it. And so I was sitting on eBay trying to bid against all these Tour de France cyclists, you know, for this keto. My wife was like, but that was, I mean, this is the kind of state of mental health for people, is that the medications are really helpful for the acute states where you're in hospital or something, but in the long run, it's so difficult to live a normal life on any of these paradigms of treatment at the moment that people will go for anything that looks helpful. We did this study where we're looking at how many people are reporting about this online, and we found hundreds of reports of people with bipolar describing, and we categorized them by the improvement of benefit, and it was you know, it was like 14% in remission, something like over 60% reporting significant improvement, like above what they'd ever seen on medication. And again, it's just these patient experiences, but they are so numerous that it's hard to ignore now. And we're trying to obviously bring them into this channel as more detailed kind of reports. And when you listen to people speaking about it, the benefits they're describing are of a different category to what you ever experienced generally in other treatment paradigms. So we do hope this will help to move the discussion forward, and the trials are coming. This is what we're working on next. So it'll be very exciting to see how it develops. And at the moment, having support from people like yourself to talk about this is so incredibly helpful, because it brings into this, and there is, like you say, the stigma against mental illness. So we appreciate all the more anyone that is willing to bring attention to this and to talk about it. I just wanted to ask, what was it personally that made, like, a lot of people would be so worried, being a board certified medical doctor, to do things like keto with their patients and to talk about this as early as you did. What was it that made you, that kind of gave you the impetus to do that? Because it takes a lot of guts to do that when, especially at the time when you were starting to do it, when keto really wasn't as known about as it is now. At least now people know what keto is, and you can,
Yeah, I would say it was a couple things, and maybe it had its root in frustration. Frustration that I wasn't having the impact with my patients that I wanted. I wasn't seeing the success for them that I really wanted. And then I found something that all of a sudden was working better than anything I'd really seen before in terms of a lifestyle intervention. And frustration that evidence existed. There are papers and there are studies going back to 2008 and even 2002. I mean, there are papers that really just aren't talked about. So it was sort of frustration about that, and feel the need that if, I can't say nobody was talking about it, because certainly people were. I mean, you look at like Dr. Steve Phinney and Dr. Jeff Volek, they've been talking about it for ages, right? And people were talking about it, but just not enough voices. So feeling sort of like the obligation to lend my voice to that movement. And again, not to say that everybody needs to be on a keto diet or it's the one diet for everybody, but to not even have it as an option in general medical practice just seems so wrong and so frustrating to me that I just felt like I had to promote it. And, I can't say that I never had any legal concerns. I mean, there are some, people on Twitter, which can be for better, for worse, Twitter is what it is, but people saying like anybody promoting a keto diet should have their medical license, removed and should be sued by their patients. And like, these are doctors saying this, and just like, what, why don't you take a step back and just ask what our goals are? Our goals are to help our patients, and we found something that can help patients, and we're trying to promote it as a potential option for, a subset of people. Like, why do we have to get so riled up and defend our position against anything that could be a potential threat? So there definitely was some of that. But, once you realize that there is scientific published evidence in peer-reviewed journals to fall back on, that, that the legal concerns kind of melt away. Now, if you sort of promote that ketogenic diet is the one diet for everybody and everybody should try, and it's going to cure everything, it's going to, proven to cure all this, and you're speaking in that way, all right, then you're a little outside of the bounds. But as long as you help keep things in perspective. And so when it comes to, mental health, we obviously have to be clear about the state of the evidence, that it's in its infancy, it's emerging, there are studies coming. But at the same time, what's the perspective? What other options exist? What are the downsides of those options? And where can a ketogenic diet fit into this along with other care, not as necessarily a complete replacement for other care? You can see the same thing for cancer, right? I mean, people who have cancer, they're desperate to find an answer and a solution and try and get back to their normal life. And the treatments we have, some are, depending on the cancer, some can be effective and some are just awful treatments. So you look for anything you can to have an adjunct, knowing that we don't have the randomized controlled trials, but you're to say, what are the other options? What are the downsides to trying it? And just broaden the perspective a little bit within a reasonable framework. So I sort of see a parallel between those.
I can totally see what
the opposition from these doctors. Do you think some of the opposition from these doctors comes from they're attached to the traditional model of diagnose, prescribe, especially in psychiatry?
Yeah, I think so. I mean, that's how so many of us are trained, unfortunately. And diagnose, prescribe, it's quick, it's easy, and it's effective if you're, depending on what you're measuring, right? If you're measuring overall quality of life and what other, activities is the person doing and how do they feel in their life, that's very different than saying, okay, how many manic episodes did you have? And did you have any psychotic, episodes in the past few months? If that's what your focus is on, then the medications are effective. So it's broadening that focus though. And again, the same parallel with cardiovascular health. What is your LDL? If that's your focus, then a ketogenic diet's the wrong treatment for a number of people. But if your focus is what's your overall cardiovascular health, metabolic health, do you enjoy your lifestyle? Is it something you're going to stick with? And then all of a sudden you broaden your perspective, and a ketogenic diet's a much more enticing option. So same thing for psychiatry and mental health. Yeah.
Right. It's like you could prescribe 20 milligrams of Zyprexa and I could not have any manic symptoms or psychosis. I would be miserable and I would be bedridden and I would be unable to live and I would have no joy in my life. So if you're measuring that as a marker, then you're successful, but you're really not. But go ahead, Ian.
Yeah, totally. No, I relate to the frustration both on the patient side and on the doctor side. It's for patients with mental health. We know the treatments aren't working. The attempted suicide rate is so high that you just have to conclude that it's not working. The people, there's no worse failure than when patients can't stand their quality of life so much they want to disappear. So we have to conclude that's happening. And on the psychiatrist side, they know that we're not approaching this in the most effective way we could. And they see that because of these results, and they want to do things different. And every time I've spoken to psychiatrists, I've experienced this incredible openness to looking at this through a different lens. We have an amazing professor at Edinburgh called Danny Smith. He's one of the only heads of psychiatry in the world that's like really got behind this and said this could really work. And it's because he focused on circadian rhythm, and he said this is an energy disorder. This is a disorder and a dysregulation of energy in the body. And it makes complete sense that a metabolic intervention could work. And he's very much like yourself. He's science-based and wants to see the evidence come through. But he's like, this makes sense to me, and I want to see patients benefit from this if they can. So I'm really hopeful for the future because of people like yourself and people like these early psychiatrists that are saying this does make sense. We need to look into it. And so thank you for setting an example for that, for being someone that could be successful and really help people with their career and with their life, and also taking the risk to do that at a stage when not everyone is willing to go into that. And I think only in time people will respect that and they see how much it really helps people's lives. So I hope all the psychiatrists watching this will be inspired and see that this is hopefully the direction we head in is what Bret's achieved through this. Could you speak to in terms of as we go into this, and we're doing these pilot trials at the moment, and at the end of this year we'll have some results, and then we're hoping to go into larger randomized controlled clinical trials. Is there any advice you would give to the teams that are working on this at the moment? A lot of them watch this podcast. Is there anything you could say that you think would help steer this in the right direction?
Wow, good question. I'm not sure what advice I can give the researchers other than to hurry up because we want to get the evidence. No, but I'm just so thrilled that there are so many researchers interested in studying this, and that there are groups supporting it. I mean, obviously the Brazuki group being one of the biggest one with the Brazuki Brain Research Fund, and like group supporting it. What the bigger advice I would give is for anybody else who is hearing this and who has means or wants to make donations or wants to contribute to connect with these groups, because we don't have big pharma drug companies sponsoring these trials, and that definitely puts the researchers at a disadvantage. You don't have a blank check to just have 10,000 person trial that's going to last for a number of years. So that's sort of where the grassroots supports needs to come from. So I don't know what advice to give the researchers other than to give everybody else advice to support these researchers, because I think we need it, and that's how we're going to get the best evidence the soonest.
Did you find a model of one of the big problems with this is at the moment, early stage researchers, the track for them to have a career and to have an income from being, working in this field is to go down kind of traditional routes. And it's very difficult for people to, I basically, the way I actually worked a full-time job whilst I did my PhD and worked in this for about 5 years just to be able to do this, and I had to turn down lots of things where I could have got funding because I wanted to keep going on this ketogenic diet route that nobody, a lot of people in our, at the time were not understanding it and not seeing it. And thank goodness the Bazookies have come and reignited this field, because it could have died out if it hadn't been for that happening. And so is there any advice you give to these early stage researchers or people that are doctors that want to go down this route but are worried about the prospects? They have a family and they want to have their career go well and they're worried about these things. What advice could you give apart from just being really brave and doing it like yourself? What?
I don't know. Get a side hustle. Start washing cars. I don't.
That's
No,
what I
I'm
did.
sorry.
That's literally what
Joke.
I
Is that what you did?
did. Yeah,
No,
for sure.
that's such a hard question to answer, and such a frustrating question to have to answer. That somebody would even have to be in that position.
Yeah.
Is so frustrating. And I don't know. I mean, I guess I don't know the ins and outs of the grants in the university system well enough to give advice, other than to say, work when it's a passion is so much better than work for work's sake. And passion doesn't always pay the bills, but it certainly makes life better. It makes the birds chirp a little louder and the sun shine a little brighter in so many different ways. So I just think it's so important to follow your passion. I mean, I could still be working in the hospital as a general cardiologist, making a lot more money, but boy, when you talk about no passion, that was it for me. I couldn't do that day in and day out. So, it's not specific advice other than, passion means a lot in life. And I don't think we focus on that enough.
I think that's it.
And
like
also meaning and impact. Like this work is going to have a significant impact over the coming decades as the keto movement picks up steam. So, and knowing that you're doing something and it's going to, person who's depressed or manic or some other illness is going to potentially get better. It's a lot more meaningful.
I love the research, the psychology research that says, if you want to improve your mood, your well-being, how you feel about yourself and your life, help others. Like that's the number one thing you can do to improve sort of your outlook on things, is helping others and having that mission to help others. Yeah. So I think that is really important.
I don't know if you saw episode 3 of this podcast, but it was a guy, we used a nickname for him, Blaze, and he was someone that I was speaking to online on forums, and he was signing up for assisted suicide. And I see people like this all the time, just week in, week out. This is the kind of state of mental health, is these posts constantly appear. And so we're saying, listen, before you do that, just try and go in this trial. We were sent him to Shivani in Stanford, whose trial was already started. And he went on this trial, and 4 weeks later, he posted this thing saying, I cannot believe what has happened. I'm like going into remission of bipolar for the first time in my life. Like I just cannot believe this is happening. And then he posted another 2-month update saying that his life has turned around. He's working again for the first time. He's like reintegrated with his family. And like, as soon as you see that, and I get emails sometimes from people saying like, with the line saying you've saved my life, and that is the passion that like makes you like, oh my goodness, there's nothing else that's worth doing apart from things. So I think when psychiatrists see that will kind of give a huge boost to this movement. There's nothing that can replace that. Yes, we're very, it's very exciting what this can do for people. And I just want to be respectful of your time. We've taken up an hour, but thank you so much for coming on to join us, and thank you for sharing about what's happening, and especially at these early stages from a patient perspective. We really appreciate all you're doing. It's such a massive help. Thank you. Is there anywhere?
My pleasure.
Where's the best?
Pleasure.
Where's the best place to find your work online?
A few spots. I guess dietdoctor.com is where most of my educational guides are, both for the general public and for clinicians. Of course, we've got the Diet Doctor podcast, which is also on YouTube, and we do a series of YouTube videos, a couple every week, talking about new studies that come out and sort of ways to look at it, different topics. And then anybody who wants to work with me as a patient at low-carb-cardiologist.com. So those are sort of the main ways. And look, I mean, I appreciate the opportunity to come on and speak with you today. And I want to thank both of you for being on the Diet Doctor podcast and for all the work you're doing. I mean, for fields like this, it's so important to have the connection of the clinicians, the researchers, the individuals with the experience, bringing it all together, to sharing the message in a way that people get it. So clinicians understand it, and people with the condition or with loved ones with conditions understand it. I really appreciate how you're doing that and how we can work together to do that. I think that's just so powerful, and it's my pleasure to be here today to do that with you. So thank you.
Thank you very much.
Thank you.